So we wondered about the supply situation here. I sat down with the chief of emergency medicine at Seton Medical Center at UT. Not only did he give us an honest assessment of what his staff is doing, he also gave us some in-depth context on COVID-19. Your doctors and your nurses, what are the guidance that they're getting, and do they have like the supplies that they need, and how are they protecting themselves?
When we are doing things where we might have some risk, we're putting on personal protective equipment, and at this time we have a reasonable supply of that personal protective equipment, and we're taking steps to try to conserve that supply. So we don't have a big fear of that in this community right now. I know some parts of the country are experiencing pretty significant shortages, and I can't promise we won't be one of those, so we're being frugal with how we use the equipment, but we are using it to protect ourselves. None of that is designed to be scary for the patient. It's all designed to make sure that people understand if you're my patient and I'm coming at you in a mask and a face shield and a gown, it's because I want to keep you safe. And I'm getting exposed to things all day long, and that's the risk that I took when I signed up for the job, but that doesn't mean I have to put that risk on you, and I'm going to do everything I can to protect you.
Is the guidance that you're hearing, I think what I've seen is that young people can still be affected by this and perhaps be asymptomatic, but they can still get the virus.
The percentage of patients who are ending up in the ICU who are under the age of 50 seems to be higher in the United States than it has been in Europe or Asia, in the communities that have been hit so far. The solid message is that being young makes you less at risk. It does not make you immune. I think if people are congested in their nose and not having a fever and not having the body aches and that sort of stuff, it probably is allergies. And if it's moving on down into the chest and they're getting a fever with it, then it's more likely to be infectious, and just all the more reason to lay low and keep away from other people. Recognize that things in public are going to be contaminated, and so what you want to do there is, as soon as you get home, wash your hands, or even as you're leaving, wash your hands, use alcohol-based hand gel, something like that, and that way, if I handled money that has the COVID virus on it, now the money's in my wallet, now I'm hand gelling, now I no longer have that germ on my hands. Hand wash more than you ever think you need to, and anytime you touch anything that's public, hand gel or wash your hands again, especially before you touch your face, because this is the way in and this is how the germ gets there. I think it will be helpful for future flu seasons and things like that we're getting this really high intensity reminder that that disease can kill, and that there are simple things that common people can do to prevent that.
The doctor says social distancing is key. He said jogging and biking are probably safe right now, but the location matters. If you're on the hike and bike trail around Lady Bird Lake, for example, it could be pretty crowded, so you might pick a different path.